Hi everyone, welcome to Hanu Medical Education. Today I am discussing about gait. The definition of the gait is it is a rhythmic cyclical movement of the lower limb in relation to the trunk, resulting in a forward propulsion of the body. The normal gait cycle has two components. It has a stand phase and swing phase. Around 60% of gait cycle the stand phase will occupy, and around swing phase will be seen around 40% of gait cycle. Coming to the gait cycle, it will be divided into two parts and it will be subdivided based on the stance and swing phases. Here we are discussing in details of the stance phase and swing phases. This is the stand phase. The stance phase consists of five stages like heel strike, flat foot, mid stance, heel off and toe off. Sometimes heel strike will be also called as initial contact depending on the literatures. Now I am discussing about the complete events in the stance phase. So first one is heel strike, and that one is here there is a heel strike or initial contact. It refers to instant at which the heel of the leading extremity strike the ground. It means the first touch of the ground or to the respective limb. Next, coming to the flat foot. In normal gait, it will be occur in after the initial contact or heel strike. It accounts around 7% of the gait cycle. It is the first instant during the stance when the foot is flat on the ground. This is the flat foot stage. Another one is mid stance. It is the point at which the body of the weight is directly over the supporting the lower limb, like here. This is okay. It accounts usually around 30% of the gait cycle. Next one is heel off. It is the point at which the heel of the reference extremity leaves the ground. Usually it is accounts around 40% of the gait cycle. This is the heel off stage. This is heel off stage. Another one is toe off. This is the last one is toe off. It is the instant at which the toe of the foot leaves the ground, usually around 60% of the gait cycle. Next, sometimes it will be subdivided into heel strike or loading phase or mid stance and terminal stance and push off phases and pre-swing phases depending on the literature, but traditionally we are using these five initially what I discussed in the five components like heel strike and flat foot and mid stance and heel off and toe off. Next one is swing phases. It has mainly divided into three components: early swing phase and mid swing phase and late swing phase. In early swing phase, it begins once the toe leaves the ground and continue until the mid swing, or the point at which the swinging extremity is directly under the body. Coming to the mid swing phase, it occurs approximately when the extremity passes directly beneath the ground, so beneath the body, or from the end of the acceleration to the beginning of deceleration. It means the initial stage, early phase, is also called as acceleration phase, or late swing phase, also called as deceleration phase. Between there is a mid swing phase. Lastly, there is a deceleration phase or late swing phase. It usually occurs after the mid swing phase, when the limb is decelerated in a preparation of for the heel strike. It means started in the next gait cycle. Next, some of the important terminology we have to know, especially for what is the step length, what is the strider length, what is the cadence. So first I have to explain the step length. The step length is, there is a linear distance between the two successive points of contact of opposite extremities. Here you have to see the step length. This is a one foot. It means example of you have to take the left foot from the heel strike to right foot of heel strike. Between the distance there is a step length. What is the strider length? It means it is a linear distance between the two successive events that occurs accompanied by the same lower limb during the gait. It means you have to take the distance from the left foot, heel strike of the left foot to the same left foot comes consecutively of left foot heel strike. Between the distances there is a strider length. What is the cadence? Cadence is, there is a number of steps taken by the person per unit of time. It may be measured as a number of steps per second or per minute. It is usually around 80 to 120 steps per minute. Next, coming to the joint motions, it means movement of the joints at which level during the gait cycle, what are how much of angle will be taken in normal gait for each respective joints. Primarily I would like to explain the sagittal plane. There is a initial one is initial contact or heel strike. Here there is a hip flexion. This is a hip point, this is a knee joint, this is a ankle joint. There is a initial contact or then during the heel strike, there is a hip flexion around the nearby 20 degrees of hip flexion and 0 degrees of knee and ankle joint. Next, during the flat foot stage, decrease the angle of the hip flexion. It means up to the 15 degrees, and there is increase the flexion of the knee joint and ankle joint. It accounts the around 15% of 15 degrees of knee joint and 5 degrees of ankle joint for the plantar flexion. During the mid stance phase, there is a neutral position of the or 0 degrees of flexion in the hip joint level and around 5 degrees of flexion in the knee joint level and 5 degrees of flexion in the dorsiflexion at the ankle joint. During the heel off stage, here there is a hyperextension of the hip joint around to 10 to 15 or 20 degrees, and there is a 0 degrees of knee joint and 0 degrees of ankle joint. This is of heel off. During the toe off stage, there is a same continuation of the hyperextension of the hip joint, but here there is a increase the flexion at knee joint around 30 degrees. Okay. Next, Coming to the ankle joint, there is increasing the plantar flexion up to the 20 degrees. Okay, here there is a 20 degrees of, these are the toe off stages. Next, coming to the acceleration phase and mid swing phase and deceleration phase. During the acceleration phase, the hip joint flexion will be again started during the flexion and 20 degrees, and there is increased flexion of the knee joint, means around 30 to 60 degrees from the toe off to acceleration phase or early phase of the swing phase. And also there is decrease the plantar flexion, it means 22 coming to the 10 degrees. Next one is mid swing phase. There is a increase the flexion of the hip joint and also decrease the flexion of the knee joint compared to the acceleration phase. And also there is a 0 degrees of plantar flexion, or which means being the neutral position of the foot. During the deceleration phase, there is a increase in the hip flexion, means by 30 degrees. There is a 0 degrees of knee and ankle. Two another words have to do. I am explaining here regarding the ground reaction force and also center of the pressure for the foot during the gait cycle. What is the ground reaction force? It means when the man or person will take the step, the force is applied to the ground by the foot and by the ground to the foot. These forces are equal to the in magnitude, but direction will be opposite opposite. It means equal forces in a opposite direction. Another one is center of pressure, COP. The center of pressure of the foot on the supporting surface moves along a path during the gait and produce characteristic pattern like we are explaining here. During the heel strike, the center of the pressure will be on the heel. During the flat foot, just distant to that one. And also during the mid stance phase, it comes under the near to head of the metatarsals, and during the just before the toe off, it will comes under to at the level of phalanx levels. This is a sagittal plane of internal movements of the lower limb during the gait cycle. The internal, according to Winter, there is a supportive movement will be seen in during the gait cycle by supporting opposite action of the external supporting movement. It means the internal extensor movements keep the leg from the collapsing during the stance phase, because hip and knee movements may vary considerably among the individual as long as the net amount remains an internal extensor movement. The body can vary how it accompanies its supports. If the ankle plantar flexors are deficient, the hip extensors and or knee extensor can be compensated. If the contraction of the knee extensors cause pain, the hip extensor or ankle plantar flexor can be compensated for that. Though the supporting movement charges from a net internal extensors to the net internal flexor movement in the late stance that cause the continuation to the swing. In late swing, a net internal extensor movement and appear again, presumably to assess the in the final position of the limb for heel contact. Here you have to observe the gravitational, so ground reaction force vector, and also COP, center of pressure. It will be changed from the initial contact to the toe off. The ground reaction force vector will be during the initial contact, it lies anterior to the knee joint line. In the flat foot, it will be posterior to the knee joint and anterior to the hip joint. During the mid stance phase, it will lies anterior to the both ankle and knee joint and posterior to the hip joint. During the heel off phase, there is a much more anterior to the ankle joint and knee joint, just posterior to the hip joint. Here on at the level of toe off, there is the gravitational, so ground reaction force vector will be anterior to the ankle joint and just posterior to the knee joint and also hip joint. These are the ground reaction force vector will be changes from initial contact to the heel off phases. These are the regarding kinematics and the kinetics of the gait cycle. So I will explain all those things briefly, but coming videos I will be explaining in details of the remaining topics. Thank you everyone. Please support to us, my channel. Thank you everyone.